What's up, meatheads? Welcome back to another Meathead Minute. Tonight we're going to talk about rice, and it needs to go away. That's right, no more rice for anybody. Now, if you think I'm talking about the food, you're wrong. That's actually my staple carbohydrate most days. It's really easy and cheap. In fact, a lot of athletes use rice as their primary starch source. What I'm really talking about is the method of recovery after an acute injury that involves rest, ice, compression, and elevation. Now, this was the standard of care for musculoskeletal injuries for a very, very long time, but it's time to fry rice. Rice needs to go, and I'll tell you why. If we're talking in the first 24 hours or so, yeah, this might be an okay way to deal with your injury. However, moving forward from that, you're actually going to make things worse by practicing rice, and I'll tell you why. Acute injuries are not designed to sit static. The body is never designed to sit static. And if you don't start rehabbing your injury almost immediately after it happens, you're going to be setting yourself up for failure. Now, obviously there are specific situations where you have very large traumatic injuries that need imaging and bone setting and reduction of joint dislocations and things of that nature. But I'm talking about your basic run-of-the-mill injuries where people were like, oh yeah, just throw some ice on it, rest it, put a compression sleeve on it. That's not going to get you better. It might make you feel a little bit better in the short term, but your long-term recovery from that injury is going to be significantly hindered if all you're practicing is rest. The body needs to move. Motion is lotion. And if you're trying to come back from that injury, you have to start with your rehabilitation exercises within the first couple of days. So relative rest, sure, don't go back to your full activities. A little bit of ice after your rehab exercises, if you think that feels good, is fine. The data shows us that ice doesn't actually do anything except work as an analgesic. So like I said, if ice feels good, that's fine to use it. Compression, that's more of a placebo effect, a proprioceptive tool. And elevation, yes, this can reduce some swelling, but really doesn't do a whole lot for you in the long term. So if you're out there and you've sprained your ankle, a little tweak in the shoulder, in the back, of course, please get evaluated by your provider, but rice may not be the answer. And people who are up to date on the sports medicine literature, especially on the provider side, should know that this is the way to go. Early movement is the key to injury recovery, not rice. Now, if you want to eat some rice after you get hurt, that's fine, but don't use it to treat your injuries. All right, until next time, guys, Dr. Meathead out.